Ethiopia has registered great achievements in many health service indicators over the last decade through a well-coordinated effort from the government, local and international partners and the public at large. Various international organizations have repeatedly extended appreciation to the government and particularly to the Ministry of Health for their success in view of the right policies formulated for the sector. The country has deployed thousands of health extension workers to different parts of the country through its flagship program known as Health Extension Program. The program has received universal appreciation for reducing child and maternal mortality rates, enabling the nation to meet targets of the Millennium Development Goals ahead of the target year 2015.
Ethiopia has already achieved the reduction of under 5 and infant mortality Millennium Development Targets 3 years ahead of schedule. But today we have also received and launched a report which shows estimate of maternal mortality in many countries across the globe, and Ethiopia is one of the countries that have made a very good progress with a reduction of 69% maternal mortality over the last 20 years.
The achievement also carries broader significance since Ethiopia is the second most populous country in Africa and plays a critical leadership role in the continent through its active involvement in the African Union. In many ways, the progress made in the health sector in Ethiopia has become a powerful global symbol of what can be achieved in resource-constrained environments and has given many international partners renewed faith in the future global health development.
Ethiopia is very much on its way to achieving the MDG 5 target, which is the reduction of maternal mortality ratio. We're not saying now that Ethiopia has achieved it, as it has achieved the infant mortality target 3 years ahead of schedule, which is great, which is celebrated. We are saying Ethiopia is very likely in a position to achieve the maternal mortality ratio target by 2015.
Recently, the Global Alliance for Vaccines and Immunization, Gavi, appointed Ethiopian President Dr. Mulatu Teshome as its replenishment and fundraising champion. Gavi is a public-private global health partnership committed to increasing access to vaccinations in developing countries. The Gavi Alliance held its replenishment launch meeting in Brussels, Belgium last week in the presence of its current champion, President Dr. Mulatu Teshome, European Commission President Jose Manuel Barroso and other high-level officials. Addressing the European Commission-hosted meeting, President Mulatu Teshome briefed the attendees on immunization activities in Ethiopia, as the country is one of the beneficiaries of the Gavi Alliance through its immunization support service. Ethiopian Ministry of Health recently announced that child immunization coverage of the country has reached 83%. According to President Mulatu, this has direct relation with the country's socio-economic development.
Ethiopia has registered significant progress in socio-economic development over the past decade by achieving an average GDP growth rate of 11.2% for the last 10 consecutive years. Building on the successes and achievements, our 5-year development blueprint, the Goals and Transformation Plan, aims to foster broad-based development in a sustainable manner to achieve the Millennium Development Goals.
Ethiopia has reduced its under 5 mortality rates by 2/3 between 1990 and 2012, which is the required reduction for meeting targets set under the Millennium Development Goal number 4.
Federal Democratic Republic of Ethiopia, Mr. Mulatu Teshome, that I really want to welcome here. I understand this more than anyone, and I'd like to congratulate him on his country's achievement last year of reducing by 2/3 child mortality, meeting the 4th Millennium Development Goal.
Ethiopia is one of the very few African countries which achieved the MDG 4 3 years ahead of the set deadline. As you know, the major causes of death in children under 5 are mostly vaccine-preventable diseases. Availing vaccines for the common killers of children was one important step to reduce the morbidity and mortality in this age group.
In 1990, the under-5 mortality rate in Ethiopia was one of the highest in the world at 204 per 1,000 live births. By 2012, this rate had been slashed to 68. This achievement was driven by political commitment, advances in science and technology, and improvements in health, nutrition and family planning services, particularly in rural areas. Indeed, the country has in many ways been at the forefront when it comes to bringing basic health service to the doorsteps of the rural population. Since 2003, more than 38,000 government salaried health extension workers have been deployed to over 15,000 posts across the country.
The health extension workers are locally recruited young women, high school graduates, with an additional year of intensive training in the delivery of packets of key health promotion and disease prevention interventions. As women, they are more acceptable and accessible to and trusted by local women, and especially mothers and children who are the primary beneficiaries of their services.
The Federal Democratic Republic of Ethiopia, front runner in aid effectiveness, was the first country in 2008 to sign with international partners an International Health Partnership Country Compact. It was in 2008, as I said. And I'm pleased that the European Commission has been able to contribute to the health extension program and is currently joining the MDG Pooled Fund in Health through UNICEF.
At the forum, intended mainly to raise funds needed to continue and expand Gavi's work, the European Union Commission pledged to increase its contribution to 170 million euros from 2016 to 2020. The current fundraising champion, President Mulatu, called upon the world to contribute and save children's lives in developing countries.
I call on the world to join us in ensuring the success of Gavi's replenishment. The Alliance's dream of delivering vaccines to millions of the world's poor children has now come a reality thanks to Gavi's partners, donors, and also recipient partners.
With full funding, Gavi will be able to help countries to vaccinate an additional 300 million children and save 6 million lives in developing countries up to 2020.